So my research is about looking at people with epilepsy, those with active epilepsy and those with resolved epilepsy, and looking at their cognitive outcomes. We looked at both categories of people with normal cognition and those with mild cognitive impairment. They were recruited from 39 Alzheimer's disease research centers and longitudinally followed over time. Their cognitive status was assessed very thoroughly at each subsequent visit of follow-up. And we found that people who had epilepsy and those with healthy cognition were more likely to convert or develop mild cognitive impairment or dementia earlier compared to people who did not have epilepsy. When we were making these comparisons, we also accounted for other factors like age, sex, race, education, which are all factors that can impact development of dementia and mild cognitive impairment. And then we also looked at cardiovascular risk factors, hypertension and diabetes, which can also impact the development of mild cognitive impairment or dementia. And that we found that people with healthy cognition with epilepsy had earlier conversion to mild cognitive impairment or dementia compared to people who did not have epilepsy or had resolved epilepsy, even after accounting for all of these other risk factors. On average, epilepsy patients were developing cognitive decline around 5 years earlier than people who did not have epilepsy in this cohort. Separately, we also looked at a group of people who already had mild cognitive impairment, which means they have some cognitive deficits, but they're still able to perform functioning. And they were longitudinally followed to see if they developed dementia or not. Again, we divided that group into people with epilepsy and people without epilepsy. And we found that people with pre-existing epilepsy, which means that who had epilepsy at the time of enrollment, did not have a higher likelihood to develop dementia compared to those with resolved or no epilepsy after accounting for all the other demographics that I mentioned earlier and the cardiovascular risk factors, which are known risk factors for dementia. So I feel like knowing that the presence of recurrent seizures in the recent past or active epilepsy is more significantly associated with dementia or mild cognitive impairment development compared to absence of epilepsy or even like resolved epilepsy. It just tells us that there's a need to more aggressively treat people with epilepsy and get their seizures under control because epilepsy in itself seems to have an association with earlier cognitive decline. So perhaps aggressive treatment of epilepsy can slow that cognitive decline. So the next step for my own particular research is going to be trying to identify the risk factors for epilepsy in older people and those with dementia, so we can also do early screening and identify them early, because once we identify them, only then we can treat them. So yeah, I think the main takeaway is that epilepsy should be identified promptly, and we should treat it aggressively and try to get seizures under control. But also, cardiovascular risk factors are also important when we are thinking about cognitive decline in older adults with epilepsy. So getting their cardiovascular risk factors under control, such as hypertension and diabetes, are also extremely important because these are modifiable risk factors that can be altered with appropriate management. So those are the two important takeaways: aggressive management of epilepsy to get seizures under control, and management of modifiable risk factors, including hypertension, diabetes,